To help us chart a course to prevent and end these diseases, these robberies, is our policy panel moderated by Sharon Lerner. Sharon and her colleagues are going to come up to the stage now. Sharon's an award-winning environmental journalist, one from whom I've learned a lot about in the last year at ProPublica. Among her many outstanding contributions was a 2017 expose on the dangers of the pesticide chlorpyrifos, and I'm told an outstanding article in the New Yorker just released today. Sharon and her colleagues are going to come up to the stage now.
Like a lot of people in this room today, I spend my time thinking about health and chemicals, and so I thought, that I would know everything, or I'd be familiar with it, and I am familiar with what we've been hearing today, but I'm also bowled over and shocked yet again, and sad, really. But it's just been really powerful, and I just wanted to acknowledge that, how great it has been to hear from all these people who are so close to these issues in different ways. So yes, today, right now, we're going to be talking about policy. And yes, these are the experts, and I'm very excited about everybody who's up here today. And I'm also, we heard a little bit of the food panel got into policy a little bit, and you can tell it's a difficult conversation, I think, that we're going to have, because really every incidence of an environmentally caused disease is, in a way, a policy failure, right? We have failed to prevent exposures that led to really terrible health outcomes. So I think we are going to start by everyone talking about how they came to this work, and I will introduce folks, starting with Danielle Carnival, and ask you, we'll do it one by one. I'll start by talking about Danielle, who works for the White House. She leads the White House Cancer Moonshot Project, and has a background, a PhD in neuroscience, right? So she has the brain cred, and also works in essentially the beating heart of government policy, or maybe the brain of government policy, right? So Danielle, let's start with hearing about how you came to this work and a little bit about the work you do.
Yeah, of course. So thank you. As was said, I am a neuroscientist by training, and took the course of following a policy path, which landed me at the White House many years ago, and then back this time around. I am the Deputy Assistant to the President for the Cancer Moonshot. But important to this conversation, I'm also Deputy Director for Health Outcomes in the White House Office of Science and Technology Policy, where I lead a team that's broadly focused on improving human health outcomes. I don't have to say it in this room, but we know that depending on the measure, but overall, those health outcomes have started going in the wrong direction. The pandemic was a big hit, and we haven't rebounded to the place that we want to be. And so my team looks at everything from how we build research infrastructure and systems, from data to clinical trials, to public health and prevention, to preventing the next outbreak from becoming a pandemic, to thinking about how we can address rare diseases where the financial incentives aren't in place to do it from the private sector, and a number of topics that overlap with a lot of the issues today. The other thing I will say is, importantly, for this crowd, I was the inaugural CEO for a patient-driven national nonprofit in ALS called I Am ALS. So I worked directly with the ALS community for a couple of years and learned a lot from them. So I can stop there.
I think that's a good place. We'll have a lot of time to get deeper into it. To my right here is Ted Thompson, who works directly on public policy for the Michael J. Fox Foundation. And I would, correct me if I'm wrong, but I would summarize your job as pushing for good policies for people with Parkinson's, and in particular, preventing Parkinson's, right?
Yes, exactly. Ray mentioned the National Plan to End Parkinson's Act that's been driven by our team in Congress, modeled after the National Alzheimer's Plan, which has been phenomenally successful in terms of getting additional resources. Interesting, I mean, I work for a research organization focused on a health condition, but a great amount of my time the last 7 or 8 years has been on the intersection of the environment and human health, because there's so many triggers of Parkinson's disease, which we'll talk about during this panel. Paraquat being the one that is that we've been fighting the longest and hardest to try and get banned. TCE, which the EPA has announced a near total ban on that. It's not finalized yet. But there are other environmental risk factors that trigger the disease. One of the challenges in this space is you can be exposed to something when you're 5 or 10 or 15 years old, but symptoms don't appear for decades and upon decades later. So it's hard to get that, straight line. Well, like Dan talking about the TCE exposure at his law firm, you can have an exposure and not have any symptoms manifest for decades. So so my role is to push good public policy, and the answers to all the panel's questions about what can we do or what should we do, it does all center around public policy. So anxious to continue the discussion.
So Ken Cook, on the end, is the founder, co-founder, and executive director, or president
Yeah. But I made it up.
of the Environmental Working Group, King, and it comes at public policy from a slightly different, well, also traditional advocacy, right? Like Ted was describing, but I would say there's another or several other layers that EWG does. One of them is science, right? And another is sort of publicize, making people aware of the science, your science, and other science, right? That sort of brings the fire and the political will to press for policies. Yeah? Can you tell us about
we're done.
Okay.
That's right. That's exactly right.
Tell us how you got to that.
So first, just in a little bit of departure, I want to give a shout out to scientists and health professionals who step into the public square and plant their flag. Ray Dorsey, you epitomize that breed. And I'm so grateful to have been invited here. Colleagues from EWG are joining me. We need more scientists and medical professionals to step up as you have done and speak truth to power, talk about scientific uncertainties, and yet talk about the importance of addressing environmental toxicants of all kinds. And I also, of course, we have to give a shout out to Jennifer Wexton and Ed Markey and Cory Booker and many others in the political realm who play a similar role. There are a lot of issues they could talk about. They pick these, and they represent us, and there are so many champions. I want to also respond, since you mentioned science. We publish peer-reviewed papers. We publish guides like the Shopper's Guide to Pesticides in Produce. The Dirty Dozen and Clean 15, as it's also known. And I'll just say briefly, you should just use it. And the reason you should use it is the reason that Nora Ephron in Heartburn said that any food with capers is better without capers. The same is true of pesticides. The important thing for us at EWG now, we participate in regulatory processes, we develop risk assessments, we play inside the box. We don't always do it. I think we might have been someone that Michal was thinking about when it came to leveling criticism at EPA and EPA scientists. I myself am not known for my judicial temperament. And so I have been guilty of that a few times, more than a few. And no one likes it. It's hard to get criticism from people you think are your friends. And I think that was a big part of her message. what I found myself wanting to say is, don't forget how industry talks about EPA and your scientists, calling it junk, calling it non-science, calling it completely untethered to reality, referring to enforcement actions in terms of Gestapo and so forth. I think the erosion of trust in science has come much more strongly from that end of the continuum than it has from what I would say is the folks gathered in this room. But for me, the most important thing that I want to emphasize is that, as we've heard all day long, I don't think anyone here probably thinks that risk assessments of one chemical at a time, we've done them at EWG many times, is likely to bear fruit. I don't think anyone probably, if you were listening today, thinks there's a very good chance that we're going to do assessment of mixtures as we find them in our bodies, or assessments of cumulative exposures. We did a study in 2004, and we found, I think it was 217 neurotoxic substances in umbilical cord blood. And that was spending $10,000 a sample looking at all kinds of stuff beyond neurotoxic agents. And my point there is, no one can reasonably think, A, that we can come up with a model that will evaluate those mixtures, right? And let's say you did. Then you immediately pit the industries responsible for putting that stuff in our babies against one another. So where are you going to reduce the risk? Are we going to do a little less PCBs? Well, they're already banned. We're going to do a little bit less lead, a little less this heavy metal, a little less this OP. It's unworkable. Which brings me to the need to whack-a-moles faster. We just need to whack them faster. We need to reduce exposures as our first goal. And that should be the case, not just from our scientific precepts, but in how we translate it, and Ray's book is a great example, how we translate it to people. It needs to be done in a way that's democratically accessible, affordable. It needs to be in a way that that's the norm, the expectation, and exceptions to it are things that we need to focus on with great intensity. And we also need to make sure that as we do that, we continue to move the whole economy in the direction of environmental health. There's no other way to do it, even as we play within the boundaries when we have to play within them at EPA, within that box. They can only do what the law lets them do. But that doesn't limit all the rest of us. There's plenty of things we can do now, more than ever before, in the marketplace, motivating citizens, directly reaching individuals. And I'll just say one more thing, and then I'll save it to the end. I do have some ambitions for where I think EWG will go next, and as I'm looking at the sort of the last chapters of my career, I also have some goals that I have set for myself, and we can talk about them if opportunity arises later. Is it a bucket list? Well, I'm reminded of President Obama at the 2015 White House Correspondents' Dinner. He was asked at the end of his term, does he have a bucket list? And he said, no, I don't have a bucket list, but I have something that rhymes with bucket list.
Nice. Very nice. So, thank you, Ken. So, I'm really glad you brought up that statement about being critical of EPA. And I think it sort of rankled, perhaps a few people in the room. And this, if you weren't here, Danielle, it was Michal Friedhoff, at the end of her talk was saying, don't criticize, don't say people at EPA staff scientists have a conflict of interest. Don't say that. If you say that, it's like she equated it to basically COVID denial, And I think that, I think that there's tons of good work going on at EPA, and there's so much good intention. But I also think that what we're talking about today, policy, it takes place in a political context. It takes place in the context of not having enough money, and importantly, in the context of immense industry pressure. The companies that make these chemicals, they care about the regulations placed on them, and they don't want them banned. And they have the money to make their voice heard many times over. So in that context, I would say EPA is really successful in many cases at fending that off, but not always. And it's really important to address that. It's my job and the job of other journalists, to point that out. And it very much has an impact on the conversation we're having today. So I'm glad you brought that up. Okay, Danielle, I want to hear some more specifics about the overlap, it's not just the overlap, but like how your office has specifically, what you've done specifically on preventing brain diseases. And one thing I'm particularly interested is the work around veterans. So if you could speak to that a little bit.
Yeah, context for why the Cancer Moonshot piece fits in with today.
Please.
Is that cancer is personal to the President, First Lady, personal to probably everyone in this room, nearly every American family. That's one reason why there's a Cancer Moonshot.
Yep.
But the other reason is that the President, even when we started back in 2016 when he was Vice President, really clearly saw, especially through the experience with his son, how you end up in a situation with a diagnosis like glioblastoma, and you assume that there's answers. You assume that you know how it was caused. You assume that there are treatments. You assume that there's a healthcare system ready to walk you through all of the options, or that there's a trial out there. And they learned themselves that that wasn't the case for that diagnosis. I think, and so when taking on the Cancer Moonshot and reigniting it in 2022 as president, the goal was always to show what's possible, to use cancer as the tip of the spear to drive action in all of those areas that I talked about, to show what we should do for the entire system. Because changing an entire healthcare system, as we've seen over the last decades, is pretty difficult. But really driving forward on something that people can kind of get behind, American people can get behind, was the goal. That's why we're really proud of the steps that the Biden-Harris administration has taken on prevention that relate to cancer, but also relate to brain health. There have been actions from EPA on ethylene oxide, on lead, on the first ever drinking water standard for PFAS, on putting billions of dollars of the bipartisan infrastructure law into cleaning up Superfund sites. We shouldn't have to brag about that because that should have already been done, but it wasn't. So we're going to say that we took the action and made the steps and took that on. It's not enough. There's a lot of new understanding. There's work on pesticides that both of you mentioned that still needs to move forward, but I think it is worth noting the steps that should be taken, that have been taken because of not just the Cancer Moonshot, but because of a focus on environmental justice and on equity from the beginning of this administration. The piece you talked about on veterans, I think, is a really important intersection, which happens to connect to the glioblastoma diagnosis, which is a brain cancer, in case anyone didn't know. But the president led in a bipartisan way the passing of the PACT Act, which is a once-generation step to provide additional care and services to veterans and their families, especially those that had toxic exposures during their service, who now have over, I think, 200 diagnoses. VA is always updating the list based on science, including brain cancers and many other conditions. And the part of that that I think is most interesting, would be most interesting to this group, is that we understand that there's a link. We can't tell you specifically all of the details right now to show cause and effect But we're going to take care of these veterans who were put in harm's way because of their service to this country. And in the meantime, we're going to fund research that better understands these connections. So that's what the National Cancer Institute and the Department of Veterans Affairs, the Department of Defense, and even the Department of Energy, bringing in their supercomputing power to be able to really understand the proteomics, the broader set of genomics and other impacts in the body of these exposures throughout the course of someone's time in service, to better understand and make the connections, not only for new treatments, but for understanding how to take on regulations or additional steps to prevent those exposures in the first place.
Yeah, I was going to say that. I mean, it's wonderful, the stuff about getting the benefits. I've certainly interviewed a lot of veterans who have been sickened by chemicals, particularly the ones in AFFF, the firefighting foam, who have been unable to get benefits, and they're so frustrated, right? But I know especially from the Camp Lejeune conversation we had earlier, what people really want is not to be exposed in the first place.
That's right.
Right.
You know, can
And
I
you
just
can do all three at the same time. You
Yes.
can do the benefits, you can study while you're removing the initial costs.
I just have, if I could just make an editorial observation. I was thrilled to see your name and your statement at the PFAS announcement
Thank you.
as representing the whole of government approach and speaking from the perspective of a policy framework that, in our view, hasn't adequately emphasized prevention before. And for you to step out and talk about PFAS, a drinking water rule, given your position at the top of the cancer moonshot, I just want to say thank you. It was really impressive to see these things finally being tied together. So thank you.
Yeah.
Well, I will just say to that, I mean, I appreciate the applause, but it's just common sense.
Of course.
Right? Like, we know how we've made progress in reducing the impact of cancer and other diseases, and prevention
Yes.
is always the best way to do it. It's 2 out of 5
But it's
of
common
our
sense in
goals.
Washington is not that, it's
And
kind of unusual.
I want to be the bummer here, and as much as it was thrilling, I've written about PFAS quite a bit, and here's this action that, this is what everybody's been waiting for. And we heard today about how, from Dr. Friedhoff, about how the 2016 law is supposed to help us not repeat ourselves, not repeat history, right? And so it's amazing that this happened. I know, having talked to a lot of people affected by this chemical, they all, wanted it to happen a long time ago. But the piece that I'm interested in, because I've been thinking about this a lot lately, is like, how do you prevent this? Not just, how do you prevent the exposure in the first place from happening again in the same way? And what happened was these companies knew that they were dangerous, and they knew that they were accumulating in people's bodies, and they knew they were out in the environment, and they went ahead and made them. And in the end, what happened is EPA caught up with them many decades later and fined them $10 million. $15 million, things that mattered nothing to these multinational corporations, and they, so the law was working, policy was working, but it wasn't working because now every single person in this room and on this planet has them in their blood. So how do we not do that again is something I'd like to think about as well. Okay.
Well, and piggybacking on that a little bit, 10 to 12% of all people with Parkinson's served in the military. And the reality is, and I think you're indicating we've turned a corner, but we expose our servicemen and women to, whether it's Agent Orange, Paraquat, heavy TCE, burn pits, all these things. And then after the fact, we're like, oh, gee, they got sick. They got an illness. I mean,
Oops.
there is a thing called wind. If you dig a big hole and burn a bunch of toxic stuff in this big hole, and the servicemen are, 5 miles away, well, the wind doesn't only blow in one direction.
Right.
So it's like,
Right.
that's where some of the common sense stuff, and I didn't know this before. It was asserted earlier today that the DoD is the biggest polluter in the world. I'm not sure if that's true, but
True.
but they certainly do have their hands on a ton of different chemicals. And prevention of disease like Parkinson's, if we eliminate these environmental risk factors, we will have prevented a subsection of that population from ever getting the disease. Now, the tough thing with that is I will never be able to prove that, because unless you get the disease, how do you disprove, that somebody, or how do you prove that somebody didn't get a disease? But that's a big part of our research strategy too, is identifying Parkinson's long before diagnosis, seeing what and we announced the biomarker last year, and that's going to enable us to look further and further in front of the disease diagnosis, so we can come up with therapies to eventually prevent the disease.
ALS is service connected as well.
Right.
Ted, I wanted to ask you about some of the nitty-gritty about how you do your work. What particular laws are you focused on getting passed right now? And what do you find, having done this work for a long time, what do you find, how do you convince a lawmaker to do this? And what are the headwinds you're facing?
Well, working in the disease space, it's a little different because most members of Congress are not going to get elected or reelected because they helped out with a specific disease space. So they're doing it, for earnest reasons, which is great. Right now, the biggest difficulty, no surprise, is the polarization that we have. Senator Booker's name was mentioned. He's leading an effort in the Senate, Congressman McGovern in the House, to have a dramatic pesticide reform bill, or to reform our pesticide approval process, to bring the European precautionary principle here. It would also ban paraquat outright, and there are roughly 90 chemicals that are banned in Canada or the EU that are allowed in the United States. It would require the EPA to immediately review those approvals. I think it was Ray's assistant a couple years ago in an email said, "So when do you think this is going to come up for a vote in the Senate?" I said, "The day before never."
Yeah. Well, why is that? Let's talk about why is this not successful? The
politics have changed so much. I said to somebody earlier today that if what we know now we knew in the 1970s, we might have actually been able to get something done. Because in the 1970s, both parties recognized environmental degradation, the need to protect the environment, health issues. The EPA and OSHA were both established during the Nixon administration. So everything has become so polarized. Everything's become a culture war issue. We were joking about how measles is making a comeback because people aren't getting their kids vaccinated.
But are you facing specific opposition on these issues? Are people pushing back against your effort, and if so, who?
I will mention, I don't know if it was mentioned earlier, but the air pollution standards that were recently adopted. There's a Congressional Review Act bill that was introduced, and that's the ability for Congress to override an administration if they issue rules that the Congress doesn't like. And nearly every Republican senator has co-sponsored this legislation to overturn the air pollution rules that were issued. So it's industry, it's ideology. On our issue, like the National Plan to End Parkinson's Act, which we've been working on for a couple of years, it did have 9 no votes. And Newsweek immediately jumped on that. Who are these 9 congressmen that don't like people with Parkinson's?
And?
Which we're not going to touch that with a 10-foot pole. Other than to say there are certain members of Congress who I don't think have ever pushed the green button. It's not everybody out in Congress are here for the right reasons anymore. Social media has a lot to do with it because you can get lots of attention, but you don't have as many serious-minded people working on solutions. I know Senator Markey's going to be speaking after us, but he led the effort on the TSCA legislation and was able to get that through in a bipartisan fashion, but it's just really difficult.
Ken,
we couldn't establish EPA today.
right.
We couldn't
Probably
pass
couldn't.
the Wilderness Act. We couldn't pass the Clean Air Act.
Well,
Couldn't do any of that today, right?
right. So that actually leads to my next question was, let's talk about California and why some of EWG's work lately has focused on that state.
And we're working with Michael J. Fox Foundation on this very issue. Look, we've gone to where there's what used to be in Washington a working majority that's pro-environmental.
Yeah.
It happens to be supermajority Democratic in California, but we've passed something like 25 bills in the past 8 years in California that EWG has sponsored, and many of them have had Republican sponsors. You can't do that in Washington because I've had lobbyists tell me, don't make a deal with me, lobbyists from industry, don't make a deal with me and think you can go to the Hill and have it hold, because even though I represent industry and I've said we want this regulation, to your point, Ted, there are people up there who say, oh, excuse me, we don't do regulation.
Yeah.
On principle. But in California, really interesting turn of events on paraquat, right? And this is on the list that rhymes with bucket. If you don't get the right decision out of EPA, we're hoping we do, but if we don't, bucket, right? Go to California. And in California, Assembly Member Laura Friedman, it's now passed the relevant committees on the Assembly side. It's about to go to the Assembly floor. We are not out of the woods. But a really interesting formulation that says paraquat will be banned in California. I think it's January 2026, is that right? Yeah. And then there will be a 3-year period after that where the agency has a chance to come back and say, no, it's safe.
The California State Agency.
Right.
Right.
So it's exactly what we've been talking about. We're a little shy about the precautionary principle at EWG. Industry's done a very good job of beating it up. We like to call it science.
Right.
See, that's where you get in trouble now.
Right. And frankly, I'm excited about this debate in California now, because basically what it's saying is, look, there's a huge scientific and regulatory cloud over this substance. It's like the list you gave of the exposures that are bad for vets. Burn pits, really? Of course, Beau Biden, why wouldn't you think of burn pits as you can't prove it, but why wouldn't you think that could go bad? Mm-hmm. Well, in this case, the industry's up at arms. They say, of course, we won't be able to feed ourselves if we get rid of paraquat, the usual line. But the interesting thing is that as this has advanced, people have begun to think, you know, that kind of makes sense. If there's enough science out there where we can't definitely make a regulatory decision, but it looks like pretty bad stuff. And it's been around since 1962. Really, this is the best you can do since 1962? Then maybe we should say, look, let's get rid of it for now and then make you come back and prove it's okay rather than make the agency prove it's dangerous. And I think what this gets to for me is going outside the box. I respect what Michal said about the limits at EPA. Just like FDA, they have their limits. They have budget problems. They have, you know, a long-standing culture of making decisions in a certain way. Very, very difficult things to overcome. Don't give up on that fight. Stay in that box and fight away effectively. But don't confine yourself to that box. Look at the market. Look at California, look at other states. Incredible work being done around the states on toxic chemicals. Any number of people here could speak to better than I could. Really important.
So do you think that what's happening in California can trickle up in some way to the federal level, or no?
Well, there's a long history of environmental laws that started in California doing just that.
Right.
But I think, you know, I would go back to Ted's point. I mean, things changed with Gingrich, and they've never gone back. So we've passed one major federal environmental law since '96. We couldn't reauthorize any of them. And the one we passed, TSCA, was written originally by industry. And thank God for Ed Markey and Michal Friedhoff for stepping in and making it better and better and better as best they could. But that thing was going to pass because it was industry's bill. So my feeling is that while we have an administration like Biden and we have great public servants on that team, we need to do as much as we can, as fast as we can, without assuming there's going to be a friendly Congress that's then going to say, you know, this gives me an idea, maybe I'll overhaul the Safe Drinking Water Act. If they introduced an overhaul to the Safe Drinking Water Act, I think most of the environmental community who works on the Safe Drinking Water Act, and there aren't very many of us, we'd say, no thanks, we're out, because it'll go bad.
Well, and I would point out, there seems to be, I don't know if you agree with this interpretation, but a sort of parallel on the other side going on with Texas, where some industry advocates seem to be going to Texas to get more permissive policies through, and then to see if they can push them up to the federal level that way. So it's almost like just, you know, the center is shifted and you've got these two outliers.
Yep.
Okay. Danielle, what would you say to people who want to pass brain-friendly policies and are trying to get these policies passed and stable in, I guess, how do I say this, administration proof? Like, we're looking ahead at an election, right? What's the kind of work that people who care about these issues should be doing right now? From your perspective, what would be really helpful for people who want to get, you know, the right thing done right now, and we're in this precarious moment?
Yeah, I think you're getting me close to two issues that can get me in trouble.
Okay, don't get in trouble.
The Hatch Act would have a problem for her, but I know one of the answers that she can't give. So
The answer I can give is, I think the Biden-Harris administration sees scientists, researchers, the advocacy community as huge partners in this work. And so, kind of, as much as we can march forward and tout the progress together while still being critical of what more needs to be done, I think it puts us in a good place because you're getting the message out to the American people that there's a broader community standing arm in arm on some of these issues. I think the other thing I would say is, and maybe the California example comes into play here, but the Office of Science and Technology Policy is a kind of weird place inside of a White House to like bring science and technology directly to a policy office. But I think what we benefit from is while we're working on improving public health, while we're working on the broader society, on driving research forward or on regulations or policies, our view is that we get to sit in a place in the administration and see over and through an issue. So what are the examples when California takes steps ahead of what the federal government is doing? How does innovation change? How do we solve the problems around food, the food supply? I know many people would say they're already solved, but I think there's a lot of really interesting innovation that can happen as we push the boundaries of where we already are from a policy and regulatory space. And I think I'm really excited about that work going forward, and hopefully in a Biden-Harris administration.
Gotcha. Ted, did you want to add to that?
Well, I was going to mention, you did make the point about how great the EPA has been on so many issues. This has been the most progressive administration. And talking with somebody in the audience earlier, it's like, but nobody knows it. Nobody knows about it. There's so much noise out there. This administration has done so many great things around health and the environment and things like that, but it's just hard to get the attention to it. So, one thing I was going to say, the Hatch Act related thing obviously is, get involved and vote and volunteer and all that stuff. But the other one that, I made reference to the congressional review legislation. From an administration standpoint, having the ability to get regulations in place, long before an election makes a big difference to administration-proof them. Could I take a
Yeah,
minute to talk
yeah,
about? I think that's our timer, so I
Oh,
wanted to.
is that our timer? I was wondering. Uh-oh, we have to do, oh, no.
Congresswoman.
Questions?
Real quick, Congresswoman Wexton, she just spoke a bit ago. I've been working with her team for about a year now on legislation, which I thought she was going to announce it, but I asked her aide if I could talk about it. She said, sure. Its acronym is the Healthy Brains Act. It's a bunch of letters or words that make up healthy brains. I can't remember what they stand for, but what it does is about 15 years ago, the National Institute for Environmental Health Sciences, they had a grant program focused specifically on Parkinson's disease and environmental health. And it was very successful, so they expanded it to be neurodegenerative disease and environmental health. So I'd mentioned this to the Congresswoman shortly after she was diagnosed, and said that in the back of our minds, we would like to make this a permanent program. So she's hopefully this month is going to be introducing this legislation that will create a permanent Centers of Excellence program at the NIH focused on the intersection of environmental risk factors and neurodegenerative disease. To my knowledge, there's only about 5 of them right now. It's Parkinson's, PSP, ALS, and Alzheimer's. MS to some degree, but theirs is a little bit different type of environmental issue. But it'll be the first time there's been a permanent program established for this. My view is it's a legacy maker for her, because you would think that everything we've been talking about today would be important enough that the Congress and the administration would actually pay attention to it. Yet we have no permanent programs focused on these things and focused on prevention. So when that bill comes out, we're hoping to get, and it is bipartisan, which says something right there in this climate. But it only studies it. It's not going to ban anything, so it's not as touchy as some of the other issues. So.
Well, a friend from Switzerland mentions Syngenta, who make Paraquat, a Swiss company. It's banned in Switzerland. It's manufactured in the UK. It's banned in the UK. But the company Syngenta is now owned by the Chinese, state-owned by the Chinese. It's banned in China.
Right.
Is there not some way of coming at it from that point of view?
Well, I've spoken with our friends in the UK in the Parkinson space, and they've said, let me get this straight. We produce this chemical that we send that gives these illnesses and kills our closest ally in the world. I said, yes, you do. And they said, well, maybe we should try and do something about that. I said, yeah, you should. I mean, we can't, but the UK organizations could. Yeah, I mean, this whole claim that, we need Paraquat or it's going to devastate the food supply. Our world's second largest nation by population, China, has banned it, as you pointed out. Nearly 70 other countries have banned it. There is famine in this world, but it's not due to Paraquat.
I have been an advocate in the Parkinson's disease community for over 30 years, and today I've met advocates from other chronic condition communities. In a utopian wellness world, why can't we all just, everybody's affected by something, whether it's cancer or heart disease or neurodegenerative diseases. We all have something, or we're all going to get something. As far as I know, we don't all get out of this alive, but many of us face these chronic conditions. So what is it going to take? And certainly, Danielle, when I heard you say you're one of the co-founders of I Am ALS, what is it going to take for us to outnumber the industry? And those industry folks are living with conditions as well. So it's not going to happen in my lifetime, probably, but I'm thinking about the children and the grandchildren and the 7 generations after us. What is it going to take to make that kind of impact?
I don't think it's about numbers, but at least body counts. But
It's the right case to make, though, right?
Yes.
People, just by human nature, are more driven to solve problems that they can understand or that impact them. So making the case of the impact of a number of the things that we've talked about today that are eventually going to impact your family is absolutely the right case to be making. I will say, one, there's two very talented co-founders of IMALS. I was their inaugural CEO. I don't want to take any of the credit of that organization from them. But they, like you mentioned on the legislation and you were talking about partnering, there is a lot, especially across the neurodegenerative disease space, of partnering because there's a lot of shared problem solving. But that is still, as you pointed out with the Healthy Brains legislation, most easily done on the research side, more difficult to move to the prevention and regulatory side, but not impossible. And there's examples of how that's been done.
Yeah, and we do work in coalition across diseases, oftentimes, within the neurological disease front, but even, we partner with cancer and biomarker coverage at the state level. We do work together with the other disease groups. And we're working with EWG, looking at potential environmental health coalition, because we're stronger together as well.
Yeah, I think you've touched on something that's been bugging me. If you looked back 15 years at the major professional associations representing science and medicine around all of these chronic diseases, it was a very different picture than it is now. I mean, look at the American Neurological Association. The keynote speech, I guess 2 years ago, the president's address, was on toxic chemicals and the brain. Look at the Endocrine Society. My gosh, they are way to my left in what they say about endocrine disrupting chemicals and how they got into our world. Incredibly robust. The same is true, obviously, American Lung, on and on. A few of the research entities are not quite there yet, but they're all looking at prevention. And all of this comes down to exposure reduction as an aid to reducing the burden of chronic diseases, right? And oftentimes the very same behavior patterns, identification of problematic products and chemicals and ingredients, in many instances that can be done in a way, a lot of what we do is, to try and describe these options for people. They're realistic, they're affordable, they cut down dramatically on tens of thousands of exposure events for individuals every year, and it affects cancer, neurological harm, endocrine disruption, immune system dysregulation, et cetera. So I think you're on the right track.